Thank you, Izat. Good afternoon, everyone. My name is Rosemary Riel. I'm the Assistant Director for Academic Service Learning with JHU Source. You're joining us today for our 2023 kickoff of our Source partner panels. These partner panels emerged out of COVID, still wanting to stay connected and bridging our partners' wonderful work with our student, staff, and faculty. So today's Source Service Partner panel, we're going to focus on health equity and justice in Baltimore. Before we begin, though, I'd like to take a moment to share a few acknowledgements that we respectfully acknowledge and give thanks to the Piscataway tribe, including the Piscataway Convoy tribe of Maryland and the Cedarville Band of Piscataway and the indigenous people who are traditional owners of the land of the Chesapeake Bay, as well as the traditional owners of the lands and waters of the United States of America. All of that to say is that we acknowledge the impact of racism, systemic oppression, including practices of redlining, colonization, and genocide, as well as state-sanctioned violence on the lives of Black and Brown folks in Baltimore. All right. Again, welcome. This is a little bit about your host, Source. We are the center. Our mission is to engage the Johns Hopkins University Health Professional Schools, that is medicine, nursing, and public health, with the Baltimore communities in mutually beneficial partnerships that promote health and social justice. And this is a snapshot of our 4 core values. Today, I'd also like to introduce you a little bit to, we are also adopting Johns Hopkins Principles for Community Engagement. This really is a way to help have a guiding pathway of how Source builds our partnerships with the folks that you'll be listening to today. We have partnerships with the 3 speakers and their organizations. And the 5 principles here: shared vision and values, mutuality and respect, transparency and communication, shared decision-making, and commitment. And so again, our shared values are listed there: reciprocity, justice, service, collaboration. And for events like today, we'll start off with folks in the room taking a peek at our ground rules and group agreements, so we can, again, establish a foundation of how we're going to engage with one another today. But please know that these principles are ones that we utilize to help align us with our partners and making sure that we are committed, staying committed and accountable to one another. So here are a few group agreements. If you can take a minute or two just to look through those and see, and maybe after you've scanned those, if you have anyone has any comments, feel free to come off air to share if there are any that are missing. And if you agree, if you could give a thumbs up. And this is helpful for our speakers and how we'll engage our discussion today. I think it's an important way to, again, keep us all accountable of how we're going to engage with one another, since we'll be sharing experiences. All right. We don't quite have everyone up. I'll give everyone a little bit of time. There we go. Please don't be shy if you have any questions about the group agreements, about how today's discussion will unfold. All right. So thank you, everyone. Now, for our panelists today, I'd like to have them, each of them, introduce themselves, and they'll have a brief introduction about themselves, and as well as their organizations, and our topic today around social justice and health equity work in Baltimore. Can I ask one of our panelists to start? Thank you, Suzanne, and I'll pass it over to you.
The top of the list, so I'm happy to.
Sure.
Hello, and thank you so much for having me. I'm Suzanne Schlattman. I am the Deputy Director for primarily development here at the Maryland Healthcare for All Coalition. We are a relatively small but mighty nonprofit advocacy organization here in Maryland with a mission to expand access to quality, affordable healthcare. And I'm a graduate of the Hopkins School of Public Health, and we have many, many ties with this wonderful program, that many of which got started through the Source program. So we've had students work with us on community organizing, grassroots outreach and organizing, looking at policy analysis, doing communications, like the whole gamut, but all really aimed at how do we make the situation here in Maryland, whether it's the healthcare system or the policymaking system, more reflective of the needs and better address the needs of all Marylanders. And we've made great progress in this, more than 20 years that our organization has been in practice. We've gone from uninsured rate here in Maryland of about 15% to today's rate of about 6% uninsured. And that's a huge improvement, and it's reflective of the hundreds of organizations that we work with that have been, all a part of this effort to help pass laws in Maryland that make it easier for people to get quality, affordable health care. But we know that we want to get to 0% uninsured. So right now we have a SOURCE student working with us, SOURCE service scholar, who's been doing some work on campus and supporting the campaigns we have going on during the legislative session right now. And I'm happy to share more information about that, but I just wanted to just do this initial introduction, and I don't want to take up too much time. Looking forward to the discussion.
All right, thank you, Suzanne. Wonderful, thank you.
I'm Adongo Matthews. I'm the Executive Director of Shepherd's Clinic. Shepherd's Clinic, we actually have the mission to help the 6% of individuals that Suzanne mentioned. So we take care of individuals who are uninsured and who cannot afford healthcare insurance. So our population of folks are, I think, particularly disadvantaged because we focus on the individuals who they make too much to qualify for Medicaid, but then at the same time, they're not making enough to really afford a healthcare plan. And so, our patients would, in that space, I think, face a lot of additional barriers, maybe trying to access other services in general that have those similar financial guidelines. So we've been doing this for this year will be our 33rd year of doing that. So we were around before the Affordable Care Act and after, where we've seen our services are still needed. And so we have worked with SOURCE on many projects over the years, have seen students come in very different capacities, have come in to work on from program evaluation projects to hands-on service work. So we have many opportunities for folks to contribute to our organization, and that has actually helped tremendously. Our organization is very heavily volunteer-based from the physicians who provide services. I always say we don't pay any physicians, we can't afford to, but we have wonderful physicians who volunteer, who are currently working, who have retired, volunteer their time, and also a lot of other health professionals and administrative folks as well. So that's what we do at Shepherd's Clinic.
Thank you.
Hi, good afternoon. I'm Pam Borer-Brown. I'm Director of Maternal and Child Health for Baltimore Medical System, which is a federally qualified health center based here in Baltimore. We have a history of I think we're up to about 38 years in Southeast Baltimore and have expanded to other centers. For those of you who are not familiar with federally qualified health centers, we're considered one of the safety net services. We can provide sliding fee rates for people who are uninsured. About 19% of our populations at our larger centers lack health insurance. And I hope we can get into the discussion about the inequities of our healthcare system and how that is affecting different parts of our population. Federally qualified health centers are meant to increase access to health care, but we are responsible for the community that surrounds us, not only our patient base. So in today's discussion, I hope to talk a little bit more about the work we're doing in the community. I have been collaborating with Source almost since the beginning. Have worked with some service scholars and other folks doing different projects and continue to contribute today. So I look forward to talking more about that as we go on in the discussion. Thanks.
Wonderful. Thank you for those introductions. I think the first question I'd like to ask our panelists, and each of you can take your opportunity to answer this, is what does social justice mean to you personally and to your organization collectively? We hear social justice sort of tossed around in media and in our textbooks, but what does it mean to each of you personally? And then also, how does it translate into the work that you do collectively with your organizations? And then I'll ask Suzanne to start first, since she was brave enough to start with the introduction.
Sure, happy to. So I am the product of a small town in rural Western Maryland, and it definitely takes a village to raise a child, and it was very beneficial to me to have so many people investing in me and caring about how I did as I was growing up. And that instilled a deep value of the role of community and caring for each other and supporting one another. That's part of why I went into social work and public health. And we really carry that forward here at Healthcare for All by reaching out to diverse stakeholders who are affected by, you know, the outcomes, the poor health outcomes, health disparities, when not everyone can get the healthcare they need, period. We all have a role to play in making it better. Not one of us can solve that problem on our own, and we really need each other. And that it takes a lot of time to develop those relationships and that trust to come to solutions that we can all get behind. It often requires a lot of compromise. We're in the middle of the legislative session right now. We're seeing that in real time. But you know, I've also appreciated having the opportunity to be here over the long term and seeing the long-term benefits of the policies that we've passed, and getting to talk with people who were able to get enrolled in Medicaid even before the Affordable Care Act, because of some, like, we raised the state's tobacco tax, which had public health benefits of lower smoking rates that we've seen in Maryland over time. I think it is frustrating that it's the pendulum of social justice is slow, but it does definitely get there. And we're seeing these growing pains now, and we remain committed to holding ourselves accountable. Did the policies that we pass result in what we expected it to? Did it have unintended consequences? How can we mitigate those unintended consequences, and what can we do to continue to build on that, to not be, complacent with what we've got? Oh, like 6% uninsured's okay. Like, no, we really need to get to zero. And what's that going to take? It's going to take a lot more of that commitment to, more to social justice.
Thank you.
So for me, social justice, I think it just boils down to just kind of fairness, I guess, each person having a fair go at it for the things that we encounter, and particularly what, the society is doing to support that, right? Something outside of what the individual can control, but what are the structures in place that everyone can kind of have a fair shake at it. And thinking about like healthcare for myself, I'm from, originally from the Caribbean, and our healthcare system is different, where I never thought about, oh, can I afford to, see this, or I don't have insurance or anything like that, because, you kind of you go to the clinic, go to the hospital, and, you're taken care of without any bills. And so coming over here, it's been quite different and quite eye-opening. But, to me, it just feels, it has always been my conviction, or, I've always felt very strongly that healthcare really shouldn't be a barrier. It really shouldn't be something that is, the quality of it depends on your ability to pay, especially because you might be able to pay one day, right? And then the next day you can't. And so then what is the system around you that is supporting you now that you can't afford it? So that's kind of like for me, and I guess in this work, it's quite similar as an organization. Shepherd's Clinic is really committed to ensuring that everyone that we encounter has access, the same access to healthcare, regardless of if they're uninsured or insured. We are in our building, we are co-located with a clinic that services insured patients, and we take care of uninsured patients. And our medical director actually serves both clinics. And she always says that there's, anything that her insured patients have, she wants to ensure that Shepherd's patients also have those. So medical visits, medications, labs, social determinants of health support. To the point where sometimes we get patients who are, we take care of them and now they're eligible for health insurance and they don't want to leave because they get treated so well. But, and then actually in the same vein, because those patients are, even the insured patients who are co-located with us, many of them are underinsured. And there are things that we provide to our patients that we open up to them as well. A lot of the social determinants of health, like food, we don't kind of say, well, you have to be uninsured. No, it's, do you have that need? And if we can fill it, then we do that. So a quote that we have kind of been throwing around a lot lately is from Dr. Martin Luther King Jr. that says that, of all the forms of inequality and justice, in healthcare is the most shocking and inhumane. And I think that just resonates with me personally, but also with our organization, that, this really should be kind of one of the baseline things, that money shouldn't be an option, or your ability to access it shouldn't be an issue. So
I agree with all the things that my colleagues have said. I just looked up this morning, what is the definition of social justice? And I came across one. Social justice is the view everyone deserves equal rights and opportunities. That includes the right to good health. And we talk about health being a right, or healthcare being a right. But when we look at rights and opportunities, people don't have equality of rights and opportunities. We may give lip service to, oh, we all have equal rights. This is so not true in this world. And when we look at even a healthcare encounter, one of the first things in most institutions you come across is, so what's your insurance? Where's your insurance card? Often followed by, what's your social security number? To which a very large population within our city do not have social security numbers. And simply on the basis of their immigration status, and Suzanne, I so identify when you say it's frustratingly slow. The state legislature passed the Healthy Babies Equity Act last year. A pregnant woman, regardless of her immigration status in the state of Maryland, should be Medicaid eligible. However, and after much communication with Representative Pena Melnick's office, it still hasn't happened. Maybe July, we're thinking, although I checked with Healthcare Access Maryland this morning, and they said, we've not heard a word, and they expect us to be rolling out applications to a new eligibility population in July. We better hear something soon. So it is a very slow process. And it is that many of our residents, and in spite of, and I'm sure Adongo knows very well, in spite of someone saying they're Medicaid covered, try to get specialized tests for that person, or try to find a specialist who will actually accept their Medicaid, or even with private insurance. How many people have a battle? It's like, oh no, because we don't cover that. But you're paying significant amounts of money. Why is this not? So looking at the systemic barriers that most of the folks in our city face, and society in general, we are very far from having healthcare as a right at this point in time.
All right, thank you. I love hearing the personal and then moving into the organizational, because that's really, I think, something that we miss. Sometimes it needs to be this conversation to keep us motivated. A second question for the panelists is that maybe could you share a success story or an innovative approach that you and your team have tried, or a unique program, something that's led to a positive outcome or a community impact. So I definitely heard, Adongo, you mentioned, that you also address social determinants of health. That sounded of interest to me, of just like, what does that look like? So a little bit of the, a snapshot of a nuts and bolts initiative that kind of brings to life all of the aspirations that we just talked about related to justice.
Yeah, sure. So we really began, I guess, upping our game for providing social determinants of health support over the last 2.5 years. And we, because it's one thing to say, yes, we're providing the healthcare, but then there are additional barriers, right, to folks being able to access that healthcare. They can't get there, or there are more pressing issues, right? Yeah, I can go for this checkup, but I don't have food right now, or, I have other things that I need to worry about. So we've done a lot of work to build up consistent ways to provide food, transportation, health literacy. We have programs that are supporting now, dental care, vision care for our patients. We are, we've launched, and I think this is probably a question later on, but really put some laser focus on the particular health disparities faced by our population, and are doing deep work with hypertension now, and hopefully deeper work with diabetes after our grant presentation tomorrow. But, even from those programs, we've been able to, I know one particular person who participated in our hypertension program, she had and I don't want to misquote the story, but she had like a stroke, and she was, like having the symptoms of it, and had no transportation, and walked a couple of miles to come to the clinic. And then, of course, when we found that out, we immediately, connected her with transportation. And so she had transportation to all of her follow-up appointments and things like that. But I mean, we have people who are, can you imagine having, that going on in your body, and you have no transportation? So you are walking to the clinic, you're walking to your emergency room, and, our patients have enough to worry about. We have very sick patients who would not go to appointments. One of our patients was trying to catch the bus and, fell because he's really ill, and we are making sure that he has appointments. Transportation for his multiple week appointments. Patients come in and say they don't have any food, and you could tell me all day, like, yes, take your medication, this and then the other, and my stomach is growling, I'm not hearing a word you're saying. So we try our best to meet our patients just immediate basic needs, the things that prevent that present barriers to really achieving, your health. Like, there's no way that, just by having good medication, you could manage your diabetes if you're not, eating right, if you're not, if you don't understand what good nutrition is and movement. That's kind of what we do. And we have just, we have a lot of success stories from our patients. We get a sense of fulfillment. It fulfills us to be doing meaningful work. So yeah, we're just looking for ways to make sure it's sustainable, and make sure that we're continuously listening to what our patients need and finding a way to provide that the best we can.
Thank you.
And I loved what she described. The example that I was going to share is the Health Equity Resource Communities Act, which dedicated $59 million from the state of Maryland for locally designed and driven initiatives to remove barriers to access to healthcare. And this was something that passed in 2021. So there were a lot of ideas circulating about, the pandemic and health disparities and what can the state do. And because of the work of the coalition, we had a model in place. Back in 2011, there was a pilot called the Health Enterprise Zones. That was funded again through an alcohol tax increase that our coalition advocated for to expand access to particularly behavioral health care in that campaign, but also looking at how do we address disparities. And this Health Enterprise Zone model came out, state funded, looking at ways to address social determinants of health to improve health outcomes. And it was wildly successful. It provided transportation, it provided more training, community health workers, all that. But unfortunately, Governor Hogan allowed it to sunset at the end of its 5-year pilot. So armed with all of that data and all of those, success stories, we were able to build a campaign very quickly and capitalize on that political goodwill to invest in things like what you're describing with transportation and all that, and what's now called the Health Equity Resource Communities. The first phase of that new law, which passed, is currently underway. And we have 9 pathways to health equity grantees throughout the state of Maryland. I was just in another meeting, and it's very exciting to watch these, in action. They're addressing housing, they're addressing transportation, hunger, all of that. And it's bringing hospitals, health departments, community-based organizations, providers like Shepherd's Clinic who are hearing what these needs are. And now these grants and the other programs through the Equity Resource Communities designations will hopefully be that channel of funding to, making so that funding isn't the barrier, that we're hearing and what these needs are and have the resources we need to address that and have the right stakeholders around the table to make it sustainable, to help people know about it. Like if you're having these programs, maybe there was transportation for that person who ended up walking, but they didn't know about it, or it wasn't in their language, or they're going to these doctor's appointments and they don't have translation services, so they don't necessarily understand what the next step is for them. So that has been a success story that's, again, showing that long arc of, because we were successful back in 2011 through 2015, 2016, we had a very quick jump off point to capitalize on these other moments to meet the need today. And we had source students working with us back then and on getting this round passed and helping to raise awareness about some of the new pathways to health equity grantee programs that are out there as well.
So I think it's great both of you have highlighted a lot what partnership does, because as somebody said in the first introductions, no one can do an entire societal change or combat systemic racism without involving other partners. And I have to step back a little, Rosemary, before I go to the success and kind of paint a picture. In 2009, 128 babies died in Baltimore City before their first birthday. The infant mortality rate was 13.5 out of babies out of 1,000 died before they reached 1 year. So a group of people initially convened by the Casey Foundation sat down and did a leadership in action program and settled upon strategies to improve birth outcomes in Baltimore City, which then they called SIBO, which made no sense to anybody. So after much discussion about branding, that became Be More for Healthy Babies. So over the past 14 years, we have been looking at how do we analyze the systemic racism in our city, which is what is driving the high infant mortality rates. How do we affect systemic change? But only healthcare organizations or only schools or only government agencies cannot do this. There has to be a very broad coalition to have collective impact. So we have seen, and Rosemary knows I could go on and on for hours. I will not do that. But just to see in 2018, we had seen a 35% drop in infant mortality. In 2009, Black babies had 5 times the risk of dying before they were 1 than white babies. This disparity was something that was absolutely unacceptable. The Black-white disparity as of 2018 had diminished to 64%. And a success, and then I want to do something a little more personal, but a success in that is 2 of the funded communities for Be More for Healthy Babies since the start have been Upton Druid Heights on the west side, which is coordinated by the University of Maryland School of Social Work and the Promise Heights Initiative, and in the Patterson Park North and East neighborhoods in East Baltimore, which Baltimore Medical Systems Services lead agency. But we participate in a collaborative of 9 agencies that serve families that have met monthly for 14 years. And what we've seen in both those communities, there is no longer a disparity between Black and white infant deaths. We've not eliminated infant mortality, unfortunately. It's our goal to get to 0 as well as the uninsured. But we certainly have worked on the disparity. So personal successes, we've done a lot of programming to involve families and pregnant people and trying to encourage them to seek out things they need. And a lot of it is social support. A lot of it is dependent on the social determinants of health. And one of our most popular programs over the years has been Be More Fit for Healthy Babies. And Mindy certainly knows SOURCE scholars have contributed significantly to us keeping this because it's a group of Spanish-speaking women who meet weekly at the Patterson Park Rec Center. They have an exercise session, which in their case is Zumba. Every time we try to change the exercise, they go, no, Zumba. And we go back and they also have nutrition classes based on what food their families are able to acquire. It's not giving them made up menus saying, this is how you should eat because they can't afford those foods, or it's totally foreign to their traditional diet. So what kinds of things how can we use foods that are not quite as processed, that are a bit healthier for our families? So in that program, which has functioned for 10 solid years, our current coordinator started as a program participant. And 5 years ago, our first coordinator said, I have to help out in my family business, but I think Guadalupe would be great in this role. Not only has Guadalupe been great in that role, she also has been trained as a community lactation counselor, does a biweekly breastfeeding group that has about 15, 20 women who attend every meeting, and also has been trained in parenting curriculum, circle of security. And a success related to that was we had a visit from a funder, and they wanted to hear from program participants. So Guadalupe chose, along with another facilitator, and one woman came and she said, I went to the Circle of Security. I grew up in rural Mexico, and my mother raised us by hitting us and then asking questions later. And she said, what I learned from going to that class was, I don't hit my children. I listen to my children. And then we talk about it. And it was like seeing her, and she was crying as she said this, and just to see that people are learning how to deal with different circumstances. People who come from other countries are learning where their place is in this society. They're fitting in with their neighbors. They're building community. And that, I think, is an enormous measure of success.
I also just wanted to commend you on that great work and point out that Baltimore Healthy Start was one of the 9 Pathways to Health Equity grantees. So they got almost $1 million. I can't remember exactly the numbers, but also meeting that need, particularly in the Druid Heights neighborhood.
And they're one of our collaborative partners in the East Side too. Yes, great work.
Oh, I love all of the connections through your responses. You've really given us a lot of food for thought, just the longevity of the efforts and efforts that were happening probably before you all joined your organizations, or ones that you've seen over years and decades, seeing how that has transformed. That's something about social justice, the complexity and the layeredness of, having folks come in and working together. So thank you, Pam, for saying, yes, it can't get to the challenges without the successes without talking about the challenges, for sure, and sort of the enduring effort that justice calls for. I'm going to open it up we've heard a lot about the organizations and the work in Baltimore, and I'm hoping that some of the stories have landed in different places for our audience. So if anyone feels comfortable coming offline or putting a question in the chat, I'm sure our panelists would love to hear your feedback and try to respond to any questions or that may be coming up for you in this moment. So if anyone has any questions, please come offline and share your question, or again, you feel free to put it in the chat as well. Because I have more questions, but I'd love folks to respond to what they've been hearing so far. All right, maybe we have a Monday morning shyness. I'll add it. Oh, wonderful, thank you. Do any of your organizations have services for trans healthcare? Great question.
We aren't a provider. We're an advocacy organization, but we do work closely with Free State Justice Maryland and other organizations that when we get requests, we often refer folks to. It's the beauty of having a huge coalition is there's almost always someone to refer to. Sorry, I didn't mean to interrupt.
No, so we provide primary care visits in clinic, and so any additional specialty services outside of what we are able to provide, we provide referrals, downstream referrals for that as well.
I think we, along with Shepherd's Clinic, we would, although I do know we do have some trans patients who have been patients for quite some time, but for specialized care, we do refer to partners who have, because we're basically a primary care site.
Right. Thanks for that question. Because there are a lot of intersecting challenges that go along with just even talking about, even trying to talk about social determinants of health. Any others? How about, are there any current volunteer opportunities available, or, how would someone, if you were interested in supporting each of your organizations, what's the best way to get involved or to learn more?
Yeah, so we have our volunteer opportunities up on our website. Right now, we are actively looking for behavioral health volunteers, and on our end, we are providing supervision. We have licensed clinical social workers and licensed counselors who, for individuals in that field who want to work toward their certifications, we're able to provide supervision for them just as an additional incentive. We are particularly also really interested in getting bilingual volunteers. We are our language line bill, I send out an SOS every month to my team, like, oh my goodness, it's really high, but you know, we are seeing an increased number of non-English speaking patients, and you know, we want to make sure we are well equipped to support them. So we have the language line to do that, but of course, having more bilingual volunteers not only adds to the obvious translation assistance, but also you know, depending on that person, if they are not just bilingual, but if they're from similar cultures, you know, that also adds to the quality of healthcare that we can provide. And so, yes, we are looking for bilingual volunteers in all shapes or forms. You don't have to be a medical professional. You can be, but you can also be administrative. And we are also, of course, happy to have every kind of person on our care team, but we want to be very intentional about making sure that we do try to recruit individuals representative of our largely minority population as well. So we're always trying to recruit minority providers to serve our patients. So it's on our website. You can also just shoot an email over to me or anyone that you have. Oh, they have it in the chat here. So and even if you don't see a particular thing posted there, you can definitely still inquire to see if there's an opportunity to do that. And of course, we're on the list with Source. You know, we apply for all the opportunities that come out as well. So yeah.
Not only through BMS, but through the Healthy Babies, Be More for Healthy Babies, there are always opportunities coming up. And Be More for Healthy Babies through the health department has registered as a Source partner, that's healthybabiesbaltimore.com. Rosemary is the central site. And we've got students who have done amazing projects with us. One is currently coordinating our community blood pressure screenings, doing trainings, and it's been tremendously helpful, especially because of the large percentage of Black women who suffer from hypertension and are at risk for preeclampsia during pregnancy. We want to make sure that people have opportunities to be screened frequently and have access to those screenings. So there are all kinds of different opportunities. As I said, through Be More Fit, you know, we've had a number of students collaborate with us over the years. So with us, there is not as much clinical opportunity. FQHC rules are very strict about people having certain things. We have residency programs in a couple of our centers, but you know, that's sort of a limited opportunity. But I certainly think through Be More for Healthy Babies, if you're interested, there's a very wide range of programming that would be available.
And I'm going to put our resolution in the chat if there are any folks on the call who are part of organizations who are able to endorse the resolution. That would keep you in touch with all the things we have going on. I also heard that there was interest in trans health. There's actually a rally tonight in Annapolis or virtually from 6:30 to 8. It's called the End Medical Debt Rally, and it covers a wide range of issues to press for passage of legislation to expand healthcare access to immigrants, ensure affordable mammograms, support funding for gender-affirming care, and again, ending medical debt. That's something that's really taken on by the SEIU 1199 and Economic Action Maryland. So it's not something that we're hosting, but just in case there's interest, I can put the link to that in the chat as well. But take a look at our resolution and the rally, or contact us if you have questions or interest in volunteering.
That's wonderful. Thank you. All right, I'm gonna shoot it back out to our audience members. Does anyone have any last burning questions or anything else to share with our panelists? if not, I'm going to just I'm going to put back on their screen just folks' names and that ways to work towards social change. And it was on the initial slide. And I love this slide so much because it really touches, again, the individual out to the organizational. That, you know, we've talked about advocacy and raising awareness. And, you know, social justice isn't something that one person does, or even two people, or even groups of people. It's many people over time. I think that's my takeaway today, is that, you know, you can do your part. And, you know, for the time that you're here in Baltimore, for when you go home to wherever you're going on to your next spot. But, you know, all of the experiences, I think, are rich. The successes, the victories, and the heartbreak kind of come together. So thank you so much, Suzanne, Adongo, and Pam, for taking, again, time out to share what your experiences have been here in Baltimore. It's been a real pleasure for me to just hear the interconnectedness of the partners and kind of help me move my lens back out to see how much Source has contributed to your efforts. So thank you so much today. Last slide is for the students out there and staff and faculty. If you're not already, please join us on social media to stay connected and learn more about what our partners are doing and how you might get involved. All right. Thank you, everyone.